Welcome to all my dears. Today we are dealing with the symptoms of a patient of Crohn's disease. As you know, even though a patient may be diagnosed as having Crohn's disease, it can be a mild Crohn's disease, or it may be a moderate one, or it can be a severe also. Depending on the pathological basis, the Crohn's disease may belongs to inflammatory type, or it may be a fibrostenotic type, or even it can be a penetrating type also. So, depending on the various factors like this, our patient may having so many set of typical symptoms or atypical symptoms, or with non-specific symptoms. Due to such situation, we have to specifically study some key symptom of Crohn's disease. Let us see which are the key symptom of a patient with a Crohn's disease. Number one key symptom is abdominal pain. Number two is diarrhea. Number three, great prostration or fatigability due to severe anemia. Number four, unexplained weight loss. Number five, especially in children, you can see growth retardation, or lastly, number six, as repeated oral ulcers or aphtha or canker sores. Sore may be the symptom. So, these are the key symptom that can be met in a patient with a Crohn's disease. Let us have a look over the characteristic of abdominal pain. Usually, the abdominal pain is a very heavy abdominal pain, which is very persistent one, usually unbearable, with a lancinating nature. And the peculiarity of the pain is it starts without any warning. And if the pain starts, it will steadily worsening with the intensity of pain. That is the nature of pain. It is very heavy, persistent, unbearable, lancinating and steadily worsen. And usually will not respond with the medicines. Next, about the location of pain. Usually, near about 50% of Crohn's disease patients are with a location of terminal ileum or in the ileocecal junction. That is why usually the location of pain will be in the right lower quadrant abdominal pain, or often it can be a periumbilical also. So the location will be right lower quadrant or it can be periumbilical. And next about the modality of pain. Usually the abdominal pain aggravates after eating, like that of a case of peptic ulcer or especially in gastric ulcer. So these are the peculiarity of pain of a patient with a Crohn's disease. Next symptom is regarding number 2, regarding diarrhea of Crohn's disease. Early symptoms of Crohn's disease may be varying degree of diarrhea, but the peculiarity is that the diarrhea is not much severe like that of ulcerative colitis, and it is not much grossly bloody as ulcerative colitis. So the degree of diarrhea is comparatively lower than ulcerative colitis. The frequent diarrhea which may mixed with mucus or with blood or without blood. Frequent diarrhea is a characteristic symptom of Crohn's disease. Or the complaint may be loose stools, not like that of diarrhea. Along with the diarrheic nature of stools, one of the main PC of our patient is great fatigability with a low-grade fever, with night sweats, and with or without canker sores or aphthy in mouth. Next about the symptom of number 3, symptom of weight loss. As a result of chronic inflammation of the mucosa of the small intestine or in the large intestine, the most of the proteins, fatty acids, vitamins, amino acids, enzymes, water or minerals, etc. were properly absorbed, properly digested, properly transported and properly utilized through the small intestine and large intestine. But due to the involvement of all layers of mucosa, there is efficiency of nutritional absorption is impaired, and automatically our patient will have subnormal digestion, subnormal absorption, subnormal transportation, subnormal utilization, result in a condition known as malabsorption syndrome. Due to the malabsorption, automatically that will result in unexplained loss of weight. And more than that, our patient with Crohn's disease, especially in aggressive condition. Aggressive means very severe condition. You know that the area may be affected with a varying degree of fibrosis. Due to the fibrosis, the size of the lumen of the small intestine or large intestine is getting reduced. That means lumen is getting reduced like that. It is due to the fibrosis of the colon. It is the normal colon, and as the pathology advances due to the fibrosis, the lumen of the colon is getting reduced, and the same pathology as the pathology continues, there is fixed narrowing can be seen. A small slit like. Only the lumen of the colon may get, or the lumen of the small intestine may getting very, very narrowed. So due to the pathology, our patient cannot have food in a proper amount. So the symptom of lygopodium, what it is satiability. A few or little fills up to the throat. That means patient cannot have the needed amount of food. Automatically, patient will have complaints of loss of weight. So, in first level, it is due to malabsorption, and in aggressive or in later level, it is due to the mechanical obstruction followed by fibrotic changes. And while interrogating a patient with such and such symptoms, your patient will reveal histories of episodes of postprandial abdominal pain, especially in right lower quadrant, or it may be often periumbilical also. While palpating the abdomen, a palpable abdominal mass can be felt with cramps or colic. And if there is cramps or colic with a varying degree of intestinal obstruction has to be suspected. That means while palpating, if your patient is having tenderness or a colic or a abdominal rigidity, varying degree of intestinal obstruction is to be suspected. And next, about the consequences of Crohn's disease. As you know, the involvement of all layers, that means transmural pathology, there is a great possibility of perforation and penetration of the colon. The perforation or the penetration, it can be up to the adjacent viscera, or the penetration may affect the, due to the transmural nature, it may affect the bladder and thereby pneumaturia, then to the vagina or to the uterus or to the skin, or usually in perianal region as perianal abscess or as fistulae or fissures may be the presentation of your patient. If your patient is having constant dull abdominal pain, it signifies the possibility of inflammatory abscess. That means if our patient is having constant dull abdominal pain, usually it may be because of a presence of abscess. Whereas constant severe abdominal pain, signifies the possibility of perforation. And one of the peculiarity of patient with Crohn's disease is rectal bleeding is usually less common due to the sparing of the rectum. And here usually the tenesmus is also absent. And one of the main peculiarity of ulcerative colitis is extra-intestinal manifestations are more common than in ulcerative colitis and with a relapsing tendency. So, being a transmural one, there is a tendency for stricture formation, fistulous opening, adhesions of loops of bowels, formation of abdominal abscess or masses are the base pathology of Crohn's disease, and automatically the colon become very hard like that of a hose pipe. These are the common symptoms of patient with Crohn's disease. Next we have to study about the complication, and I think that can be in the next class. Thank you.